Dear doctors, welcome to my channel. I am Dr. Sath, consultant in internal medicine. Today we will discuss how to approach SOB. This is a very important topic for every medical exam, including clinical and theory. What are the differential diagnoses for breathlessness? Acute causes. 1. Pulmonary embolism. 2. Pneumothorax. 3. Anxiety. This type of case you will get the best of 5 questions in MRCP, MD. What are the chronic causes for SOB? 1. Cardiac. Ischemia. Congestive cardiac failure, left ventricular failure, right heart failure. 2. Pulmonary. Asthma, COPD. Bronchiectasis. Sarcoidosis. ILD. Pulmonary hypertension. 3. Infections. Pneumonia, TB, abscess, empyema, ABPA. 4. Tumors. LU-NGCA, metastasis. 5. Anemia. 6. Neurological. GBS, myasthenia gravis. 7. OSA. 8. Psychological. Anxiety. Hyperventilation. First you should analyze the symptoms. Any symptoms you should analyze the following way. Analysis of the complaint avoiding jargon. Onset acute, chronic, constant, intermittent. Cause. Duration. Progression. Improving factors. Worsening factors. Associated symptoms. Remember this ASA. OCD PIVA. After analyzing presenting complaint, ask about symptoms of your differential diagnosis list. Ask questions from the patient without jargon for each of your differential diagnosis. We'll take an example, how to approach. Chronic cough and wheezy chest. Presenting complaint dry cough, SOB, and wheezes for the past 3 months. Make your DD list. 1. Asthma, bronchial asthma, occupational asthma, exercise-induced asthma, drug-induced asthma. 2. Post-nasal drip. 3. GORD, common cause of dry cough, not wheezes. 4. COPD. 5. Extrinsic allergic alveolitis. 6. Allergic bronchopulmonary aspergillosis, ABPA. 7. Cardiac asthma. 8. Carcinoid syndrome. 9. Infectious causes example. HIV, TB. 10. Churg-Strauss syndrome. Analysis of the complaint. Onset, cause, duration, progression, worsening, and improving factors. When these symptoms started exactly? Suddenly or gradually? Is it increasing, decreasing or the same? Coming on and off or all the time? Worsening factors. Do you notice anything that worsens your condition, like exposure to pollens, dust, pets, smoke, perfumes, cold weather, or exercise? Improving factors. Do you notice anything that improves your condition, like avoidance of these factors? Timing. Any diurnal variation, more in the morning or night? Association symptoms. Is cough associated with phlegm, SOB, coughing up biode, fever? Ask about the differential diagnosis list. Malignancy. Any loss of weight, lumps or bumps, fatigue. Fever was asked before. Postnasal drip. GORD, any nasal drip, hard bum, acid brush sensation? Bronchial asthma. Any history of childhood eczema, hay fever, or allergic rhinitis? Occupational asthma. What is your job? Do you feel your symptoms improve on the weekends? Drug-induced asthma. Do you receive regular medications? For how long you are on these medications? Has any newly added medication recently? Exercise-induced asthma. You asked about triggering factors before. COPD. Do you smoke? How many cigarettes per day? For how long? Extrinsic allergic alveolitis. EAA. Any animal or birds at home, bird fancier disease? Carcinoid syndrome. Flushing, loose motions? Allergic bronchopulmonary aspergillosis, ABPA, is associated with wheezes, but the cough is productive. Infection. Any history of contact with TB patient, risk factors for HIV. Surgical operations, dental procedures, blood transfusion, needle sharing, tattooing, piercing, recreational drugs. May I ask a personal question please? Are you sexually active? How many partners do you have? Cardiac asthma, chest pain, racing of heartbeats, leg swelling? Churg-Strauss. Any tummy pain, joint pain, skin rash, pain and needles in feet or hands, frothy urine? After completing the differential diagnosis question, you can go to the systemic inquiry. Here you should ask questions system-wise. Don't ask the question where you asked in your DD section. The remaining part of the history is the same for every case. I will teach you how to approach each symptom and how to do a targeted examination. This is very important for MRCP UK pacers. MRCP Ireland Clinical, MD Clinical, AMD other postgraduate exam. See you soon. Goodbye.